campus applications that come in for us. I am on the admissions committee and always intrigued when I'm reading applications and seeing what our new applicants are doing, and hopefully we'll be able to answer some of your questions today. Dr. Fahey, you want to introduce yourself?
Good afternoon. I'm Dr. Vanessa Foy, and I teach at the Baltimore campus in the Master of Science in Nursing program. And I've been here since 1994, so a long, long time.
So something that is in common for both the BSN and the MSNE is the core values. And this really comes from UMSON in general. We are looking for respect and integrity, well-being and sustainability, equity and justice, innovation and discovery. And this is not only from our students, but also from our faculty team members and also from our staff. There are so many different things that define a UMSON nursing student. And while we are going to touch on some specific characteristics, don't feel like you need to have everything lined up. Everyone is so unique and brings different things to our community as a whole. So there are quite a lot of attributes that we're looking for, but we don't anticipate that any one person will have all of these things or even the same things as their peers. So I'm going to talk specifically about BSN students and the attributes that we are looking for on the admission committee when we are reviewing your application. So in terms of leadership is very broad. Ashley, thank you for sharing a little bit about your background. Military leadership is very valuable and well respected. We've had many students come through our program who have had a military background, and they do bring a lot of great leadership qualities to our program. But if you aren't in the military, leading communities, showing us initiatives like blood drives or serving as a tutor or a mentor or even a teaching assistant in a previous course that you took, or even initiating an improvement project, whether it be where you're currently working or maybe in the school you're attending. In terms of community engagement, we like to see regular volunteering. If it is healthcare volunteering at a clinic or a hospital or even in the community related to healthcare, that's definitely a plus. And also leading and participating in service projects, something that is addressing a need in the community. It's definitely something that is valuable. Now, healthcare experience, while it isn't necessary to apply, does get our attention. So if you have had some experience, whether it is clinical work, working as a CNA or an EMT, or maybe you had an opportunity to do a shadow or an externship or an internship, that kind of healthcare experience can really give us an understanding that you have done your homework and know what it is like to be a nurse. Adaptability, nursing and adaptability go hand in hand. So we're looking for problem solvers. We want to be able to assess if you can rise to unexpected challenges. Can you demonstrate abilities to thrive in changing environments? Because that is healthcare today. And are you able to maintain composure under stressful conditions? Now, these components here, and I have a few more in the next slide, these are things that you can show us through your essays and also in your CV. So we look at those very carefully. Now, in terms of innovation and discovery, I feel like that is kind of broad. So we are looking at your ability to think creatively. Perhaps you have participated in a research study, and that could have been that you were a subject, not we're not expecting you to be a PI, but maybe you signed up to be a subject in a research study, something that has benefited the knowledge either in nursing or in healthcare to understand research a little bit better. Nurses need to have really good organizational skills. So we're looking for you to demonstrate your ability to prioritize your tasks, manage your schedule effectively, meet deadlines. So being very timely and turning in all of your documentation as the deadlines are approaching is very important. And we want to see if you can handle multiple responsibilities simultaneously. So, for example, Ashley, you had shared that you are a new mom and that you're also going back to school to complete your prerequisites. Sorry, I keep picking on you, but you're the only one who gave me this information. But that really just shows us that you have some ability to multitask because those are enormous roles. In terms of empathy and compassion, engaging in volunteer work, being involved in helping those who are in need, maybe providing support or guidance to peers or even junior colleagues where you're working currently. Demonstrating understanding and respect for diverse backgrounds and experiences is also really important. Now, passion and motivation, how are you going to show that? Well, we're looking for personal stories and experiences that really inspired your decision to pursue nursing. We want to know your why, your motivation. Someone who can demonstrate commitment to really helping others, whether it's through that volunteer work or through maybe a mission that you have done in your community or even through your religious organization. Those things can give us a lot of good information about your passion and motivation towards healthcare. Now, in terms of determination, nursing doesn't come without its struggles, but if you've gotten this far and you've decided that you wanted to apply and to go through our program, determination can be shown through a commitment to self-improvement. So perhaps you've overcome some academic challenges in the past and you have improved your grades. We always look at your trajectory of grades, so don't be dissuaded and not want to apply if perhaps, early in your academic career you didn't do as well, but then you found your passions and your motivation and your grades picked up. We definitely like to see an upward trend and trajectory. So show us that and personal stories that show us and tell us about how you could overcome an obstacle and how you can use those lessons in going forward in your education. Because there will be obstacles when you are in nursing school, and we are hoping that you are coming in with some tools already equipped to kind of handle these struggles. Do I have any questions about the examples that I gave? Okay, if not, we can move on.
Okay, in terms of the master's entry students, we too are looking for personal experiences and attributes that would make an ideal candidate for our nursing program. So just as the BSN looks for leadership qualities, we also look for leadership qualities in our prospective students. And this is because as nursing students and nurses, you must take initiative. You'll be collaborating with other members of the healthcare team, making decisions about care in a variety of settings. So how can you demonstrate your leadership qualities? This can be done through your essay and your resume. So you could write about academic projects that you have worked on, employment opportunities that you have had, work with community organizations, or if you have been in a mentoring experience. So all of these would be opportunities for you to demonstrate that you were involved in leadership experiences. Community involvement. Nurses are required to work with diverse populations. individuals from backgrounds that may be similar or different from your own. And in order to do that, you need to be able to work collaboratively with them, and any prior experiences working with people from diverse backgrounds who have unique needs and concerns would be important for you to share, because during your school experiences, as well as when you are practicing, you will be working with patients who and families who are similar in values, beliefs, and attitudes, and some who are very different. And so we need to have an appreciation for everyone that we meet, greet, and treat. In terms of educational background, for the entry-level master's students, they come to us having a prior degree. It could be a bachelor's degree, a master's degree, or a doctorate. And so they are changing careers at this point. And so what we're looking for is that the prospective student demonstrates persistence, resilience, and the ability to effectively manage an increasing academic rigor. So the prior programs will be very different from your nursing program experiences. Nursing programs are extremely rigorous, requires juggling multiple competing demands. And so this will be an opportunity for you to demonstrate that you have successfully completed rigorous sequencing of courses, and then too, that you have attained a prior degree before joining us. Experience with diverse populations means that you have some prior knowledge, awareness, and experience with respecting and valuing diversity and embracing different perspectives. So when we are working with patients, families, communities, they may be different in a variety of ways. It may be differences in terms of language, style of communication, values, beliefs, attitudes that they have related to how they safeguard health and well-being, what they do to treat any ailments, illnesses they have, as well as general perspectives about what health means. Is health a right or a privilege? Then in terms of scholarly experiences, these may be paid or unpaid participation in research or training projects. It could be that you have published independently or with someone else in a journal, or that you have created, designed, contributed to a computer-based program or any other scholarly work. And again, this can be demonstrated in your resume and or your essays. Caregiving is another experience that we look for. So as we are thinking about individuals who have prior degrees, they have lots of lived experiences. They typically are not the traditional high school to college student. And so they have had a variety of experiences, many of whom are caring for families. It could be children, it could be a partner, it could be parents. And so oftentimes we think about those caught in the middle as the sandwich generation. So I'm trying to maneuver myself, get my career trajectory set while dealing with rearing children, caring for aging parents, family members, friends, and the like. This too can be demonstrated through your essay and or your resume that you submit. Organizational skills are attributes that we take serious when we are evaluating students who are pursuing the entry-level master's program. And again, this requires organization in terms of tracking deadlines, managing clinical obligations, balancing coursework and personal commitments. And so again, if this can be demonstrated through your essay and or your resume, where you are showcasing your ability to manage multiple competing responsibilities. This might include work, school, taking multiple challenging classes, families, all doing all of this efficiently while maintaining a GPA that is worthy of admission to a nursing program, further demonstrating academic excellence while juggling multiple competing demands. Grit and accountability, extremely important. So nursing is an extremely demanding career, and that we have multiple obstacles that we have to overcome. And each and every patient encounter is different. The challenges may be different as well. So the challenges may relate to working specifically with the patient. It may be a healthcare team related challenge or a combination of both. So as you're advocating for a particular patient, you may have to run interference with a health team member so that the needs of the patient can be met best and most appropriately given the circumstances and resources that are available to that individual. Accountability. You are responsible for your actions as well as inaction. So constantly, nurses are planning, providing care, ensuring that the highest quality of care is received by patients and family members. If you, for some reason, forget a task, then you are accountable for acknowledging first and foremost, oops, I forgot to do A, B, or C. And then initiating corrective action. So if you do something right, accept responsibility and accountability for that. If there's an oversight, accept responsibility and accountability for that as well. So again, you are doing good, not harm to the patients or families for whom you are planning and providing care. Intellectual curiosity. As we are caring for patients, families, and communities, there is never a dull moment. Each and every day provides challenges. So what worked on Monday may not work on Tuesday or Wednesday, even if it's the exact same patient that you're caring for, Monday, Tuesday, and Wednesday. So again, it requires that you reach out, think outside the box, determine, maybe I should consider A, because what I'm doing currently, it worked yesterday, but not having great success with it today. So again, thinking about how I can improve care. So if an intervention worked on Monday, but didn't work on Tuesday, then rethinking, changing, shifting, doing something new and different. It also might involve working with other team members. So you identify a potential problem. How can we fix this problem so it doesn't happen again? And so again, all of this relates to thinking outside the box, coming up with creative solutions to patient problems. Are there any questions related to what we look for in BSN or master's students interested in pursuing the nursing program here at the University of Maryland School of Nursing, either Baltimore or at Shady Grove?
You can feel free to come off of mute if you do have any questions, or put it in the chat.
I have two quick questions. When it comes to the essays, Does it matter? Because I know one's about like social equity. Does it matter if the experience you talk about was paid or unpaid? Because I'm just thinking about some of the research that I've done recently. Um,
So Ashley, no, it doesn't
okay.
matter if it was paid or unpaid.
Okay. And then for the resume, is there a specific structure that you all are looking for, or it's just as whatever I've used for work in the past is probably more than sufficient?
Whatever you've used for work in the past is probably sufficient. We're just looking that it's very organized, easy to
Okay.
read, chronological.
Oh, yes, got it.
Do you have any additional tips that you think that you could offer in regards to the application and attributes, Dr. Foy, Dr. Solomon?
Well, one is always to proofread your documents prior to submission. And then the other relates to letters of recommendation. I really didn't talk about those, but they're an important piece of the puzzle as well. So when you are requesting a letter to market yourself to the committee, you need to give serious consideration to, does this individual know me as an individual, know me as a student, know what my goals and aspirations are? So can they speak to more than, yes, Tara was an excellent student. She got good grades, came to class on time, asked appropriate and insightful questions. But I have no knowledge of what Tara wants to do with that science content that I taught her. But if I know that Tara was interested in nursing and she had had these kinds of experiences, then I can address more broadly how I see Tara as a good fit for the University of Maryland School of Nursing program. And then always you have the option of requesting that you see the letter of recommendation. So my recommendation is always ask to have access to what someone has shared about you. And so I know sometimes students will select, oh, Miss Jackson was my favorite professor. And all Miss Jackson knows about me is maybe my name, because it's now on this letter requesting a recommendation, and she can look up to see, oh, this person got a B in the course. And so if that's all I know about you, I can't share much additional information. So just be extremely selective when you are identifying someone to ask for a letter of recommendation.
I will also add on, tell them the date is like 2 to 3 weeks before it's actually due. That way they're not the reason as to why your application's late. We see that a lot in the BSN as to why some of our people are just getting to the deadline because someone didn't press a button on their end.
All right, if no one has any other questions, we thank you all for joining today. This was a great session, I believe, and we appreciate your time and interest in the University of Maryland School of Nursing. As I mentioned before, if you did join us today, we appreciate that for our entry into practice programs. If you can email our general inbox and let us know that you attended today, we can offer you a one-time fee waiver code.
Yep.
I know that I did have a question in the chat regarding if someone had already paid. I do apologize, but we are unable to offer that if you've already paid for your deposit. But yeah, thank you so much for joining us today.
Thank you, everybody.